joining us now, Republican Congressman Buddy Carter of Georgia. Nice to have you here, Congressman, and you have been one member of the House who has been supportive of this blanket repeal of Obamacare. Now, as you know, the Congressional Budget Office, the nonpartisan entity, says if you do that and you don't replace it with anything, within the first year you get 18 million Americans without insurance and premiums that are skyrocketing. Explain why that is best for the American people.
Well, it's best for the American people right now for us to repeal this failed experiment known as Obamacare. This is imploding. Day by day, it gets worse. By 2018, we know that we're going to have either 1 or 0 insurance providers in 44% of all the counties in America. This has been a failed experiment. What we need to do is we need to repeal it. We need to have a glide path, if you will, a 2-year glide path by which we wind it down. And during that time, we need to come up with better ideas. We need to work together in a bipartisan fashion and make sure that we have something by then. Listen, we never said we were going to turn the light switch off. We always said that we were going to have a transition period. Well, we've got a 2-year transition period to work in, but we've got to start from a clean slate. That's what needs to happen.
Again, just to be clear, the CBO has scored this and said that 18 million people would lose their health care in year 1 under that plan, you know, in tens of millions more over 10 years. But again, I understand what you're saying is in your argument about the slow transition. You just said that Obamacare is a failed experiment and failing. Again, Democrats would argue against that, but you say it's failing. The president's policy right now seems to be let it fail. Let it fail completely. Is that responsible public policy? So just to let people lose their insurance without a solution?
Well, that's why we have this transition period that I spoke of earlier. That's why.
But I'm not talking about transition. I'm talking about the president saying if repeal doesn't work, just let Obamacare fail completely. Let the system fail. Are you for letting the system fail?
Look, we need to do the responsible thing and repeal it right now. Have a 2-year window there by which we can come up with a plan. This is a sixth of our economy. More importantly, health care is personal. It's personal for everyone. We understand that. We get it. And we will do the responsible thing and come up with another plan. You know,
so
I take exception to the CBO report saying that 18 million people are going to be unemployed. 18 million people are not going to have the opportunity, are not going to be forced to buy something they don't want. What we need to do is create a robust, vibrant insurance market where they're competing for your business, not where we're begging them to stay in the exchange, not where we're having to subsidize them to stay in the exchange.
So, Congressman, but that's not an answer to John's question, which was, is it responsible public policy to let a program millions of Americans rely on completely to fail? And you're talking about a full repeal. That's a very different thing. We are asking you, is it an abdication of duty to allow Obamacare to fail and perhaps help it along the way by not, funding the subsidies, for example, which the president has threatened, or not enforcing the individual mandate? Are you comfortable with that?
I'm comfortable with repealing it now. Listen, we'll cross that bridge
again,
when
that's just not an answer. That's not an answer.
No, it is an answer.
It's not an answer. The president is saying let it fail. That is different than a repeal. Are you comfortable with sitting by and letting Obamacare fail?
If we let it fail, then what's the worst thing that happens? We go back to what we had before it was even imagined, before it was even implemented. We go back to that stage, and at that stage, then we, again, work on something to make it better for everyone, to give everyone accessible, affordable, patient-centered health care. That's what we've said all along that we want to do. We want to have accessible, affordable, patient-centered health care. We can do that. Working together, we can do it. Now, if we repeal it, we got a 2-year period there in which we can work. If it fails on its own, then we have to get on the ball and get it done immediately.
Congressman, I just wanted to ask you one question about the Russia investigation. Your colleague Seth Moulton of Massachusetts says he's going to put forward an amendment to the budget resolution that would put House members on the record, forcing you to vote on whether or not you support the special counsel Robert Mueller's investigation. Do you think such a vote is a good idea, and would you vote yes?
I don't think such a vote is necessary. Listen, we've always said, let the facts lead us where they may. Facts are stubborn things. Let the special counsel do their work. We don't need to be interfering with it in Congress right now. We've got intelligence committees, we've got oversight committees. If they deem it necessary to look into this, let them do their work. But we don't need a vote on the floor to verify this or to justify this. Let the facts lead us where they will.
Congressman Buddy Carter, one thing is sure from this conversation, I need to up my summer suit game because that is one fantastic outfit you're wearing today. Thanks so much for being with us, sir.
You're going to be here in a light blue suit tomorrow.
I'll do whatever I can.